everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. This is another one of the Monday Q&As. This is a place where I answer your direct and specific questions. So if you have a direct or specific question to me in regard to what is happening to you, as long as it is not diagnostic, please post it below. You can also email it directly to me. My email is in the link in the information box for this video. As always, I have selected 6 random questions. I have crossed out individual's name for privacy reasons, and there are going to be timestamps below for all of you to jump around in case if that's something that interests you. Having said that, let's get going on our fascinating 6 questions for today. Question number 1. Hi, Dr. Z. I listened with great interest to your YouTube videos and find the Q&A ones very informative. Thank you so much. I love making them, so please keep your questions coming. Thank you for your great coverage of after gynephilia. If you haven't seen the after gynephilia video I did, highly recommend. It does a great job of providing critique points on after gynephilia theory according to Ray Blanchard, and it does a wonderful job, I feel, of also distinguishing between after gynephilia as a sexual preference versus after gynephilia theory, 2 different things. Question: I adore sexy, beautiful women for as long as I can remember. How do I know if my male to female gender dysphoria is not due to an idealization of feminine beauty, now wanting to actualize and realize it in myself personally? I have been on male to female hormones for quite some time and adore everything female to so much that I discovered late in my life that actually I want to be a woman. Your response will be appreciated. So how do you distinguish whether the gender dysphoria you feel, which you're describing that you have, is actually either stemming from gender incongruency or is stemming from idealization of feminine beauty? It's very hard to exactly distinguish, and I'll tell you why. It's difficult to distinguish between because, one, it is very common for individuals to have sexual preference or sexual orientation toward themselves as primary feminine individual, or toward feminizing in feminine clothes. And at the same time, it is also very common to have a transgender identity. A lot of times, the sexual preference comes first and trans identity comes later, and this is why it can be confusing, and people oftentimes think the 2 linked. This is what Ray Blanchard, in my opinion, got wrong by claiming that the sexual preference has a direct correlation and link to transgender identity, which I claim it does not. I claim that the 2 coexist. People are just not aware of it. So it could be one that for you, this is the case. For you, it could be that you already are and always have been transgender, but now just starting to come in touch with it. It's not exactly clear to say what's stemming from what. I would say if you're thinking about whether to go through gender transition or not, or how much of this has to do with incongruency, you have to go to what I always call square one. How do you feel about your gender assigned at birth? How do you feel about the way you're perceived in the gender? What kind of incongruency you're experiencing? Where that incongruency is coming from? For a lot of individuals, that could really help them clarify. But to have a clear-cut idea of what caused what or what not, oftentimes can be difficult, because as we mature, a lot of things that we experience tend to fuse together, and to sort things out can be challenging. So unfortunately, I can't give you a very clear-cut, how can you know whether gender dysphoria is not due to idealization of feminine. All I can go off on is how do you feel? What is incongruence you feel? What is it telling you? What is the distress you're feeling? And how can any steps alleviate or help you with the distress? I apologize if I can't be any more helpful, but hopefully this clarifies a little bit. Good question. Question number 2. Hi, Dr. Z. First, thank you for your insights. You are so very welcome. My issue is a dysphoria I have with my male voice. I have been working at Sephora going on 2 years. If I change my voice after 2 years, I'm concerned how my regular customers and associates will react. I've been told that my voice is okay now, but I'm still having dysphoria. I pass quite well, but I know that my voice is outing me. Passing isn't the most important thing, but I would like to have my voice match my appearance. That is my dilemma. I don't want to seem fake. Wow, laughing myself out loud, that's a funny sentence. I can see your dilemma. And I can see your dilemma in here because there's two contradictory statements, right? So on one hand, you're saying that your voice gives you dysphoria, but yet you pass quite well, but then your voice outs you, right? So not only voice gives you dysphoria, but even though you pass really well, the outing happens due to the voice. Then you say that passing isn't the most important thing, right? So at the same time, you don't really give a shit about passing, but you'd like to have your voice match your appearance. So it's a lot of, to me, what I hear is quite contradictory statements, right? And hearing all of this, first and foremost, you mentioned that you concerned how your regular customers and associates are going to react. I encourage you not to think about that. It's not your responsibility to think about how people are going to react or respond. That is on them. It's your responsibility to be who you are and to do what's you find best for you and what's most helpful for you, versus thinking about constantly about what others will think. When we do things for others in order to make others happy, we lose ourselves. And I would not want you to lose yourself. So that would be my advice to you. Now, because you're feeling there's contradictions that you're experiencing between voice, wanting to have your voice match up to how you see yourself, at the same time not really caring about passing, I would say sit down and ask yourself, how much does voice really matter to you? Remember, voice doesn't matter to everybody, but you have to ask yourself, how much does the particular voice you want to achieve, how important is it to you? What is it going to do to you? And why does it matter? If you're going to come to conclusions that it really doesn't matter and you're only doing it to make others or to in order to have less misgendering happen, then you have to weigh out that as well too, in terms of what is your reactions or feelings when misgendering happens. Some people, and they really don't give a shit because they're very in touch with who they are. Some people get very emotionally beaten down by it. And for that reason, even though voice may not matter to them, they start working on their voice just to avoid experience that emotional beating down. So it really depends. I would say write down a list of pros and cons on each category, but I would really encourage for you not to do it for anybody else, but to do it for yourself and to figure out what really matters to you. Because like you said, you don't really, care about passing is not that important to you. So but what about the voice? Because voice training can take a lot of work, and sometimes people just they're like, fuck it, it's not that essential to be, which is completely valid. So you have to figure out what's more important for you, what the your needs and wants are, versus thinking about anybody else. So that's what I would recommend, and I hope you'll be able to come to a solution, and I wish you all the best. Question number 3. Mislabeled at birth. What if there is no such thing as transgender or transgenderism? What if our labeling of children at birth is only around 98% correct? What if the rules for our labeling system are too simplistic and insufficiently exhaustive and are prone to produce errors? I hope these questions are coherent. These are very coherent questions. I'm just thinking about your question that what if we're only 98% correct? I'm just trying to understand. So what you're saying is that the 2% that were labeled incorrectly end up experiencing gender dysphoria. I assume that's what you're saying. And what if our system is simplistic or insufficient? The problem that I see, it's not with this is not the problem that I see. My biggest problem is that we tend to link and anchor gender to sex. We tend to continue to preach that individuals with XX chromosomes and with the characteristics of what we associate with female sex then has to be a woman. And that individuals with XY chromosomes, and especially with what tends to be associated with male sex, are then men. this is my problem. My problem is that we're taking sexes, female and male, and then we anchor it to gender and only two genders. And this is a bigger problem for me because gender is a construct, and gender is a construct that has obviously been evolving. How we saw a woman 100 years ago is different than how we see a woman today. How we saw a man 100 years ago is different. And those differences of how they evolved had very little to do with their sexual variability. So my problem is not so much of labeling or mislabeling children. My problem is, why are we anchoring it so much? Why are we not just maybe even I mean, God, even the sex, when I think about it, is like, what is sex, right? Because there's writers and researchers who say there's chromosomal sex, there's gonadal sex, there's like all these types of different ways of looking what really sex is. But if we're just looking solely at the hormones, my problem is anchoring it to this only two particulars and genders, and to saying that anybody who is male at birth is man, anybody who is female at birth is a woman. And that's obviously not true. A lot of individuals who are female at birth are men, non-binary, genderqueer, you name it. Anybody who is female at birth or anybody who is male at birth are identifying as women, presenting as women, are also non-binary, also demigender. Again, gender is a construct. Sex is a different thing. And it's important to also point out, because people get it confused. They think that individuals who are trans-identified are trying to eradicate sexes, and that is not true. We all know that sex variability and sex differences are a valid thing. We all know that it is a biological fact, but we're talking about genders here, which are a separate thing. So don't know how to answer your question other than to share with you that my problem, for me, the biggest problem lies in continue to anchor two binary views of gender, two, again, also, by the way, to only two sexual variabilities. And by doing so, also negating intersex individuals. Anybody else comment below? Share what your thoughts are on this question and what your insights are. Question number 4. Dr. Zia, I cannot begin to tell you how much your videos help me deal with my thoughts and feelings about being trans. You are so welcome. Thank you, thank you. I do have a question. Is it important for transgender people to understand why they are trans? I understand that being trans may be based on in-brain function, and it does for a lot of people, but I also think there are experiential things in our lives that shape our psychology and gender identity 100%. As an analytical person, this is something I continue to grapple with. So how important is it to know that you are transgender? I think that, or basically rather understand why you are trans. I think that I doubt that we will ever know exactly why people are gender other than their gender assigned at birth, because there's so many reasons why. And a lot of them has to do with numerous factors. It has to do with your biology, including your sex. It has to do with your psychology. It has to do with the environment you grow up in. It has to do with your development. It has to do with experiences that shape up your relationship to your gender. And the more people learn and understand how gender doesn't have to conform to your sex, the more people start to understand that they have freedom to explore themselves on a deeper level. For some people, with that freedom becomes an awareness that they are transgender, non-binary. For some people, that freedom leads to a further conclusion that there are actually genders that they were assigned to. So in other words, that the genders that we socially tend to correspond to sex then is something that is they feel more congruent with, right? And I really hope that one day we'll stop corresponding gender to sex. I wonder if this ever is going to happen. But I hear you. I'm also a very analytical person, and for that reason, it's even I as a psychologist can point a picture of multi-million reasons of why an individual is transgender, and all of them will be one way or another valid. So I think it's not really important to understand why people are trans, although I know that a lot of you wish you had that understanding and it's important to you. I get that. But I think more important for all of you to understand your relationship to your gender, your relationship to what is gender telling you, your relationship to how it defines you, your relationship to what it means to you. I think that's far more important to understand how you orient yourself in regards to your gender, wherever your gender may be. Those set of experiences and how you feel are more important and more rooted in self-awareness and mindfulness than trying to seek why am I this way, which I think is going down to the analytical rabbit hole of, it's like that philosophy question, which came first, chicken or the egg. You're just going to lose yourself in that. And I think by doing so, you're going to rob yourself from being present in the now and really enjoying living. What's more important is how do you feel about yourself right now? And also to be mindful that how you feel about yourself now may change. Next year may change 5 years from now, or 20 years from now, and that's okay too. We are not static, we're more complex. Great question. Question number 5. I live in a very religious area. The people who are around me are generally very anti-LGBT, very anti-science, very alternative medicine, and very socially conservative. I don't want to leave the community as it's part of my identity, just as being a trans girl is part of my identity. What is a good way to navigate through this very religious and constructive environment when you are everything the culture defines as not in group? I agree with you. You shouldn't have to exile your environment because majority of people are not agreeing with your way of being, not agreeing with your human rights to express and be who you are. At the same time, I know that today, with all the anti-legislation, anti-trans laws, it becomes that much more difficult to exist in certain parts of the world. So how can you exist in such environment? I say that would matter what you do, what your support system is. Are you surrounding yourself? Can you find people in this environment that are supportive, that love you, that understand you? If you absolutely can't find somebody in this environment and you're very adamant at remaining in this environment, are there people online that you can find, that you can connect to? Are there people from whom you can elicit support? That would be my suggestion to you. But it is very difficult to exist in an environment that does not welcome you. Eventually, I feel, no matter how confident and accepting of who you are and comfortable with who you are, eventually I feel that still takes a toll. Because even subconsciously, constantly to confront a reality that tells you otherwise and that shuffles and pushes you away is very psychologically difficult. So my initial advice would be, can you move somewhere else? But I also know that's not realistic. And it also doesn't mean that all of you have to suddenly pack up and move and run because of this. It's also not the best thing, not only feasible, but not the best thing. And you shouldn't be running. So it's just, it's a dilemma, it's like a double-edged sword, unfortunately for you, because it's like you stay and you remain in a place where you love living. At the same time, by proxy, you get this effect. So hard to say. Support system would be the key. If not support system, can you work with a therapist that can help you get through these difficult times and that can elicit you that support that you need? So that would be my suggestion to you. But so tough for so many of you. Very, very difficult. Question number 6. Hi, Dr. Z. How do I know if I'm trans feminine or just really feminine man? Great question. So I did a video this month, because I'm thinking about when this one is going to be out this month, that tells about the difference between gender identity versus gender expression versus gender role. If you haven't seen it, highly recommend for you to watch it. Because it talks about a lot of the things. So how do you know if you're trans feminine or really feminine man. Again, we're going back to square one, right? So feminine man has more to do with man as your stable core identities that you feel congruent and comfortable with. Femininity on top of man is now how you express yourself in relationship to that congruency. So your gender congruency and comfort level is man. This is your gender identity. If femininity is just the way you like to express yourself and navigate the world through while feeling stable, then this is your gender expression. Nothing wrong with that. Gender expression can often be not in alignment with your gender identity, and that's very normal and very common. Now, how can you know if you're trans feminine? Again, square one. What is your relationship to your gender assigned at birth? If your relationship to gender assigned at birth is feelings of incongruencies that then further manifest as dysphoria, what is it telling you then? How do you feel in relationship to gender assigned at birth in terms of other people around you, in terms of how people respond to you? All of the things need to be taken into consideration and factored in. It's very important not to jump to conclusions that because your gender expression and gender role can be completely on the opposite pole of gender spectrum in relationship to your gender identity, it doesn't mean that you're transgender, right? There's a lot of feminine men. There's a lot of masculine women. There's a lot of individuals who gender expression on the outside would never match their core gender identity and what they feel very comfortable and stable in. Those are two different things. So it's very important to distinguish here whether we're talking about a core stable sense of identity or whether we're feeling an incongruency, and as a result, the femininity is on the surface, is extension of who you are in relationship to gender identity. But it all goes to that core one of your gender assigned at birth and that incongruency that you feel and how it relates to you. And that sometimes can take some time to figure out. So for that reason, it's important not to rush. It's important to take your time. It's important to take little steps. It's important to play with your gender expression and gender role before getting into medical or surgical options. It's important to maybe work with a gender therapist or therapist. You can find one in your area. It's important to also ask yourself those two questions in terms of who am I? What is my relationship? How do I know? How do I understand what gender is? How do I understand what gender identity is? What does all those things mean to me? That's what I would really recommend, but it's not so black and white, and it's not always so clear cut. But don't forget, lots of feminine men, lots of masculine women, lots of non-binary men, lots of non-binary women in terms of their expression. And that doesn't necessarily mean that their gender identity is in some shape or form incongruent to anything else. Like I said, that video would be really, really helpful because it clarifies all of those facets that we tend to deal with. So that is all for today. Our great 6 questions, all amazing. Feel free to leave your questions below in the comment section or email them directly to me. I love answering a Q&A. Again, if the question is something I can't answer, you'll hear from me. If something that I will answer, you'll also hear from me because I will let you know that I will add it to a Q&A. And comment below, share what your thoughts are, share if you have any other feedback for people with their question, and I will see you all next time. Bye.